Neurophysiology Laboratory at the VA in Dallas. He returned to Denver in 2003, where he became an assistant professor of psychiatry at the University of Colorado Health Sciences Center in Denver, as well as having multiple roles at the VA as well in Denver. In 2010, he became a staff psychiatrist at the Quillen VA Medical Center here at Mountain Home within Johnson City. He is also a clinical associate professor for the Department of Psychiatry and Behavioral Medicine here at ETSU. And he is also a member of the Grand Rounds Committee, Resident Curriculum Committee, and Education Policy Committee. He instructs medical students, residents, and is a course director for the PGY3 Case Conference Series and PGY1 Psychopharmacology course. He has authored and or co-authored over 20 publications. Dr. Griffith, thank you so much for being willing to speak with us today.
Morning. We'll go ahead and get started. People will be flowing in, but this is a full, at least 55-minute talk. We'll go ahead and get into it. So the title today is Contemplative Science, Clinical Applications, Neurobiological Findings, and Philosophical Considerations. I have no declarations to make financially. So we'll start off with William James, a noted philosopher, physician, and a person who was considered to be America's first psychologist. The faculty of voluntarily bringing back a wandering attention over and over again is the very root of judgment, character, and will. Education, which should improve this faculty, would be the education par excellence. But it is easier to define this ideal than to give practical directions for bringing it about. And now to define contemplative science. The field of science which investigates the neurobiological, psychological, and philosophical facets of introspection. Now, contemplative science was initially envisioned by Francisco Varela. Francisco Varela was a cognitive scientist who also had exposure to Tibetan Buddhist practices. And he was aware of the long history of writings about direct experience of meditation practices. And he came to believe that by putting these two schools, these two approaches to understanding the mind together, that it could ultimately lead to very fruitful outcomes. From the embodied mind, he said, on the one hand, science proceeds because of its pragmatic link to the phenomenal world. Indeed, its validation is derived from the efficacy of this link. On the other hand, the tradition of meditative practice proceeds because of its systematic and disciplined link to human experience. The validation of this tradition is derived from its ability to transform progressively our lived experience and self-understanding. Now, another way that you could think about some of the data that I'll present at this talk, you could think about it in terms of the epistemology, or the theory of knowledge around it. On the one hand, we have what are typically considered to be Western studies, where we look at a small population, which we can then generalize to universal laws or to a larger population, the nomothetic. On the other hand, you have the idiographic, which pertains to or involves the study of individual cases and events. So we'll see initially studies which look at evaluations of groups of individuals, and then later we'll see more about the experience with an N of one, narrative account. Now, a bit about my background briefly is I completed a research fellowship and have worked clinically as a psychiatrist most recently, but have also practiced Buddhist contemplation for 2 decades. So to my mind, in following this literature in this field, it's been fascinating to see it come together. 20 years ago, there was no such field. So to note, for the purposes of this talk and in my view, Buddhism is a pragmatic philosophy which requires a systematic analysis of the mind. It is not a belief system. It's not a faith system. It's a practice whereby one analyzes the mind and sees things evolve step by step for oneself directly. So as these techniques having to do with meditation that have been derived from Buddhism and other practices, mindfulness, which is primarily Buddhist, most people think, as they have come to the West, we see just bits and pieces of the Buddhist psychology system. And we see these pieces generally used like mindfulness techniques in the treatment of psychiatric problems around the middle range of disorders. Mild symptoms, moderate symptoms of depression, anxiety, and so on. DBT, dialectical behavioral therapy, which was derived from Buddhism as per Linehan's report, will get down into the serious symptom range at times with those who experience borderline states. These techniques, like meditation, mindfulness, are not used for folks in this category who would be having psychosis or frequent dissociation for fear of aggravating their problems. The full Buddhist system of practice, though, is utilized for this area up here. People who are functioning in the 80 and above range. One would have to be functioning at that level to be able to utilize the system fully. And I think as I discuss it briefly at the end of the talk, it will become clear why. Now, we know that meditation is widely used. By now, with the popularity of mindfulness, the numbers are probably greater than this, but in 2007, 20 million people in America reported having used meditation in the past year. And I was amused about a year ago reading the Sunday New York Times to see this article. It was actually in the style section. Mindfulness getting its share of attention. What is the sound of one hand texting? And it was a whimsical 1 to 2 pages. And basically, Hochman said, you know, mindfulness has become so in vogue in major cities, in New York City's in his group that he runs with, that everywhere you go, people are talking about mindfulness, being mindful, going to a mindfulness class, and so on. And he likened it to the enthusiasm over yoga as it came to the West years ago. And certainly, it's become a very trendy thing in our culture. But with about 19,000 publications extant looking at meditation, it's also developing a very sound scientific basis. And indeed, many of our major well-funded institutions have centers for contemplative science. Stanford, UC Davis, UMass, in India, all over the world, Brown University, Emory, Harvard. You get the point. I could go on, but these are just a few slides to make the point that these methods are now being actively investigated. And whereas a few years ago, when I first began giving CME talks and I wanted to give something about the science to support the practice, so I could pull a few papers together and very easily and neatly discuss them. Now I have to decide amongst hundreds of papers that come out all the time. Very different. Also, too, these techniques have influenced psychotherapy and will likely continue to do so. I mentioned DBT earlier. We have mindfulness-based CBT. Mindfulness, ACT has had an interaction with mindfulness and meditation, and also mindfulness as a therapy skill. As outlined by Rubin in 2009 in the American Journal of Psychoanalysis, deepening psychoanalytic listening, he mentioned that Freud had insisted that the analyst develop the capacity for an evenly hovering attention when performing psychotherapy. But then he further noted that no one's ever really described quite how to get there. how to get to that point. And his solution, his suggestion, Buddhism's non-judgmental attention to what is happening moment to moment, he thinks cultivates exactly the state of mind Freud was suggesting. And this may be an example of his opinion realized. This is a study from 2007 in Germany. And apparently in Germany they do things a bit different, at least at this institute, because they have a very large number of psychologists in training. They call them psychotherapists. They're really psychology graduate students in training. And they have an institute where patients go to stay and go through a lot of psychotherapy over the course of, say, 9 weeks. And at the end of each period, they record multiple rating scales to see what their outcomes look like from baseline to 9 weeks out. And it must be different in Germany because their trainees basically signed a letter at the beginning of training saying, we can put you into studies, but we're not going to inform you that you're in the study. I assume those are non-invasive studies that they're limited to. And anyway, so what they did is they took 9 psychotherapists in training and had them undergo Zen practice for an hour a day for 9 weeks, 5 days a week. And then another 9 who did training as usual. And then they looked at the outcomes of their patients at the end of the 9 weeks. And they found that on multiple rating scales that the trainees who underwent meditation training had better outcomes in their patients. So suggestive. This is from 2007. It was with an N of 124, which is nice, but I haven't seen replication or follow-up. Now, to define a few terms, mindfulness is characterized by giving full attention to the present moment without judgment. Concentration meditation is the directing of one's attention to an object of focus. And loving kindness meditation gives rise to the wish, content and secure, may all beings be happy at heart. Now, each of these techniques are far more complex, but this just gives you an overview of what they might be like. So I'll first go into the clinical applications of these techniques. And I always like to start by giving Herbert Benson due credit, because in the early 70s, as a cardiologist, he was concerned about the effects of stress on his patients. And so he delved into meditation to see if it might help with outcomes. And this is his first publication in that area. They used transcendental meditation and described that it produced a wakeful, hypometabolic physiologic state where the blood pressure decreased and other parameters improved in terms of autonomic activity and reactivity. Jumping ahead to a couple years ago, here's a study that used transcendental meditation in people who experience cardiovascular disease. They looked at 201 African American men and women who had coronary heart disease and taught them either transcendental meditation or health maintenance. So they matched for time and then followed them out a little over 5 years and demonstrated there was almost a 50% reduction in the TM group in all-cause mortality, myocardial infarction, and stroke. Now, moving into some of the recent clinical research in mindfulness meditation, this is a meta-analysis from January in JAMA Internal Medicine. And this is the author who looked at and put together almost 19,000 publications through November 2012. They found 47 trials of mindfulness interventions for psych disorders and found it effective for the treatment of anxiety, depression, and pain. And this was over the course, most of these were 8-week interventions. Now, the effect sizes for anxiety, it was 0.38, 0.30 for depression. And their summary stated, these small effects are comparable with what would be expected from the use of an antidepressant in a primary care population, but without the associated toxicities. Now, I'm not suggesting that we're going to replace our interventions in the outpatient clinic with meditation and not use medication. Of course, that's indicated, and we'll continue to use the medication. But it does show that these techniques have some effect with these disorders. The other comment I would make is, from sort of a skeptical perspective, is it's true perhaps that the effects were similar to the medication effects. However, taking a pill is not as time-consuming, doesn't involve as much training as learning how to meditate. So there are pros and cons. Depends on how you think about it. Now, one thing I would one thing I will call your attention to. Okay. One thing I'll call your attention to is that the effect size of the meditation technique tended to wane several months out. And actually, that would be predicted from a contemplative practice viewpoint. And I'll touch on that more later. This is a study just released last month by Sundquist out of southern Sweden. And basically, they did an 8-week RCT of mindfulness-based group therapy versus CBT. And they found that both treatments significantly improved problems with depression, anxiety, and stress, and that there was neither group had superiority over the other. This is a study that people may have read. Who read this summer? At the very least, you probably saw the cover in the American Journal of Psychiatry in August. And what they did is they used a mindfulness intervention over 8 weeks in Marines preparing for deployment who would prepare to undergo simulated combat. And the N was sizable, about 140 in each group. So they took baseline readings, and then after they'd undergone the stressful experience, they did about 20 hours of classroom work, and they were asked to practice mindfulness each day. And this is a summary of what they found, what they reported, and that is that there was increased recovery in the mindfulness training group of both heart rate and breathing rate. The measure of adrenal activity, neuropeptide Y, decreased for the treatment group, and measures of interoception showed that the insula in the anterior cingulate had decreased activity in the mindfulness intervention group. So this is an indicator of that even as these trainees went through intense stress, those who underwent the mindfulness training came out better stress-wise compared to training as usual. This study in some ways interests me more because it has to do with our field, but it's a small N. And this was done by Josh. Her lab has been very productive in looking at mindfulness interventions. They too took Marines who were preparing for deployment, took a baseline, did an 8-week course, very similar to the other, and then evaluated them at the end. But they were interested to see if mindfulness intervention would help them with maintaining their working memory capacity, that is, executive functioning, over the course of the stress exposure. Because a lot of times, executive functioning will decline under increasing amounts of stress. And they found that after undergoing the course and then practicing each day, that for the group who did practice a lot each night, they actually improved in working memory capacity over the 8 weeks. Whereas those who did not practice as much, their working memory capacity declined. And here we see the correlation between practice time, the square root of practice time, and their measure of working memory capacity. Another study out recently just looked at the use of mindfulness intervention in primary care over the course of 4 weeks, weekly sessions, and demonstrated that the veterans who had PTSD, those who underwent the mindfulness intervention had a significant reduction of their cortisol compared to those who did not. So, thus far, then, we've talked about clinical applications. I'll move into the neurobiological findings. Now, we know that whatever is going on with meditation has to do with neuroplasticity, defined by Davidson and Lutz as brain changes that occur in response to experience. And this can happen at multiple levels within the CNS. And you could think of contemplative practice as basically a set of techniques which are utilized to guide neuroplastic changes. Because ultimately, either by design or default, we're always producing neuroplastic changes in our brains. This is one of the studies that got people's attention by Lazar and her group. They took 20 meditators who'd been pretty intense with this. They had practiced for 9 years, almost an hour a day of meditation. So they were pretty serious about it. And they compared them with age-matched controls, 15 people in that group. And when they looked at them, they found that there was greater gray matter volume in the meditators in Brodmann area 910 and in the insula, the right insula. They also found that as they looked at the older members of each group, that the meditators had less cortical thinning compared to the controls. And this is just to show the insula and area 910. So now this was a provocative study that got a lot of people's attention, but you could say, well, it's a cross-sectional study. You know, the meditators may be kind of weird anyway. They may be a little bit unusual. And so maybe their brains were already different. Or maybe because their brains were different, they wanted to do meditation. So this, the same group came back and did a study. They did an 8-week intervention of a mindfulness-based stress reduction where they do mindfulness, they do a little bit of light yoga. It's about 20 hours of training, and then this group practiced about 30 minutes a day. And so they had an active group and a weightless control group, and they demonstrated at the end of 8 weeks that the left hippocampus, posterior cingulate, and temporoparietal junction had increased in volume in the treatment group, but not in the weightless controls. And this is just to show the left hippocampus and the difference in volume. Well, there's subsequently been a number of other volumetric studies with the same model. 8 weeks of mindfulness training, baseline, and then recapture at the end of the intervention. Here they took 26 people who had to have stress 1 standard deviation above the population mean. And they checked them on the perceived stress scale, did an MRI, then took them through the study. Now, they were interested in the amygdala because the amygdala is related to stress and to fear. So they were curious to see what may happen to the volume of the amygdala as they went through the course and hopefully became less stressed. And what they found was that those who underwent the intervention had a decrease in stress, And they also had a decrease in right amygdala as well. So they had a decrease in amygdala volume that correlated with the decrease on the perceived stress scale. And now we go into the brainstem, same model, 8 weeks intervention, and they demonstrated that there was an increase in volume in the brainstem. Bilaterally, it was symmetrical, and in an area that is thought to contain both the locus coeruleus and the raphe nucleus. And these are just the correlations of the left side of the brainstem and the right side with a wellness scale. So I've kind of walked through the brain from the cortex down to the brainstem and shown that there are some changes in volume with these 8-week interventions. And one way to think about this is these areas subserve certain functions, such as thinking, working memory capacity, response to fear, and so on. So you can think about it in that way. But Willoughby Britton from Brown wrote a 2013 review paper taking a different view of it, entitled "Awakening is Not a Metaphor, the Effects of Buddhist Meditation Practices on Basic Wakefulness." And her argument is that each of these areas that have been shown affected by meditation, including the dorsolateral prefrontal cortex, anterior cingulate insula, and the brainstem structures, each of these is related to the arousal network in some way. They may get direct noradrenergic projections from the locus coeruleus, but each of them is related to arousal. Whereas the default mode network, which we'll get into in a minute, which is associated with hypoarousal, is actually active less frequently in long-term meditators. And so she made the point that while beginning meditators usually comment on feeling some fatigue or drowsiness, increased desire to sleep, or maybe increased sleep as they begin using these methods, that more advanced meditators actually describe a state of arousal, but it's a relaxed state of arousal rather than the hyperarousal depicted on the far right of agitation, restlessness, and so on. If you look at the meditation literature from hundreds of years described by meditators in the different traditions, they too note that over time the mind actually seems more awake. It seems to have more energy, better focus, and a decreased need for sleep. Personally, when I've gone and interviewed people who were very advanced meditators, informally, they describe the same type experience, that over time that they notice that they drop down, if they slept 8 hours, they drop down to 6, they drop down to 4. A lot of times they will use that waking time to meditate, so they're getting relaxation. Now, to talk about the default mode network, this is generally thought of as a mind-wandering network composed of the posterior cingulate, medial prefrontal cortex, and hippocampus. A recent study from 2010 in Science found that people spend almost half of their waking hours in default mode. And default mode is associated with low mood in many cases. And some people believe that how mindfulness is helping with depression is by taking people out of the default mode. It's a very complex story and argument we don't have time for right now, but that's one line of thinking. Also to note, in early Alzheimer's disease patients, as per the author Griffith, they showed decreased resting state activity in the posterior cingulate and the hippocampus. So it's thought that there's a decrease in functional connectivity between the posterior cingulate and the hippocampus in Alzheimer's disease. And it led these authors to take a look at the impact of mindfulness in those who have mild cognitive impairment. Now, this is really a pilot study. I think it looks like they were collecting data for a grant, but they got a positive finding and they reported it this year. They took 14 adults who had MCI, and they randomized them to either mindfulness-based stress reduction or usual care. And they did this for about 8 weeks. And they looked at the functional connectivity at the beginning of the study and at the end, and also at brain volume. And they found that the group that underwent, the group that underwent the mindfulness training had a significant improvement of functional connectivity between the posterior cingulate, the anterior cingulate, and the left side of the hippocampus. Had an improvement. They also, in looking at the volumetric study, they also numerically saw less of a decrease in the meditators compared to those who did not do meditation. But this was a numerical difference with a p-value of 0.07. So there was a trend, but it didn't play out statistically. I suspect this is leading to a grant, and we'll hear more about this in the future. Now, we talked about a lot of studies and data having to do with the clinical use and the neurobiology. Now, I'll shift a little bit and begin to move into the contemplative practice perspective by first talking about differing preferences and effects of meditation. If I said to everyone in the audience that some people would like one type of meditation and others would like another type, would that shock anybody? I mean, is that, because we all have our different natures and there are some things we like and we don't like. And so this study from 2012 just reinforced that. They allowed people to sample different techniques and then saw what they enjoyed the most. But when these studies are done, say with mindfulness, where they randomize people either to a control condition or to meditation, they don't have the option of picking between 4 different meditation practices. So imagine that I just randomly assign a technique to you that you just don't care for at all. Your practice is probably not going to be as good. You're not going to relate to it. It's just not natural for you. And if you experiment with different types of meditation, you'll see that everyone in this room would probably have if you had 4 different types, most of you would come up with a different order, a rank order of the techniques in terms of preference. So that's an issue. This is borne out by this paper by Judson Brewer this year. This is actually a follow-up analysis of an earlier report. And I'm not going to go into the details of it right now. We can talk more about it later if we wish. But basically, they saw that people who underwent mindfulness training, it was very helpful with nicotine cessation. But then, when they broke that group out that showed improvement, they found that depending upon that person's nature, their level of judgment of stimuli and of themselves, depending on that measure, some look just like treatment as usual, some look much more improved. So he entitled it, Finding the Right Match. Mindfulness training may potentiate the therapeutic effect of non-judgment of inner experience on smoking cessation. Again, suggesting that different techniques may work better for different people. And this is a slide which shows, although they called it Buddhist and Hindu practitioners, what they were getting at is that when a person is doing mindfulness meditation, the activation tends to be more in the front part of the brain, in the central part of the brain, whereas those who are doing concentration meditation tended to activate the parietal and occipital cortices. Again, a difference in techniques, different effect. So, summary thus far of the literature is that mounting evidence suggests these techniques positively impact in a number of areas, from a small to a modest degree. And studies indicate that there are, these interventions change brain activity patterns and structure. But there are multiple issues to address, including sample size, biological specificity, and duration of intervention. From a contemplative practice perspective, these studies, again, do not allow selection of the technique by the practitioner. And in contemplative practice, it's always been that way for more than 2 millennia, that you select out the particular practice you would like to use. And also, there was the loss of effect over time in the Goyle study. And I would have predicted this because actually the loss of the effect is consistent with why Siddhartha Gautama gave rise to Buddhism in the first place. And I'll try to talk about that a little bit later at the end. Now, we make a shift to philosophical considerations. And we talk about the nature of the self and consciousness in cognitive science and contemplative practice. I'm going to read some excerpts from different cognitive scientists about their views of the mind because they differ greatly. This is from Damasio, Self Comes to Mind. The answers are unequivocal. There is indeed a self, but it is a process, not a thing. We can consider the self process from 2 vantage points. One is the vantage point of an observer appreciating a dynamic object, the dynamic object constituted by certain workings of minds, certain traits of behavior, and a certain history of life. The other vantage point is that of the self as knower, the process that gives a focus to our experiences and eventually lets us reflect on those experiences. Combining the 2 vantage points produces the dual notion of self used throughout the book. This is one perspective. Now, this is by Gazzaniga, also a cognitive scientist, who did a lot of the work of split brain work and corpus callosal separations. Who's in charge? I do not think that brain state theorists, those neural reductionists who hold that every mental state is identical to some as yet undiscovered neural state, will ever be able to demonstrate it. I think conscious thought is an emergent property. That doesn't explain it. It simply recognizes its reality or level of abstraction. Like what happens when software and hardware interact, that mind is a somewhat independent property of brain while simultaneously being wholly dependent upon it. I do not think it possible to build a complete model of mental function from the bottom up. And then we go back to Francisco Varela, another cognitive scientist who wrote in the paper Radical Embodiment. We propose a new approach to the neuroscience of consciousness, growing out of the enactive viewpoint in cognitive science. This approach aims to map the neural substrates of consciousness at the level of large-scale, emergent, and transient dynamical patterns of brain activity rather than at the level of particular circuits or classes of neurons. And it suggests that the process is crucial for consciousness cut across the brain-body-world divisions rather than being brain-bound neural events. Whereas standard approaches to the neural correlates of consciousness have assumed a one-way causal explanatory relationship between internal neural representational systems and the contents of consciousness, our approach allows for theories and hypotheses about the two-way or reciprocal relationship between embodied conscious states and local neuronal activity. So those are 3 of the leading thinkers or theories around consciousness and the nature of self. Now we look at the Buddhist model of the mind. And in the Buddhist model of the mind, there are levels of consciousness that one can experience. The first is the observer of self, to continue using Damasio's terminology. And this is what's generally described as a self. That is, I think this, I'm hungry, my tummy aches, and so on. The observer and knower as 2 aspects of the self is different. The mind is able to then pull back and observe these phenomena arise and pass, having to do with sensations, thoughts, feelings, and see them for what they are, just a phenomena arising and passing. And this can be accomplished in mindfulness practice. And then finally, non-duality, where there is neither an observer nor a knower. This is realized through contemplative methods. And what I'm referring to here is not while in a deep meditative state, but actually while awaking and alert, that it's possible to have this experience ongoing. Now, you may think that by talking about this non-dual state, that I'm sort of reaching outside of Western thought. But actually, Maslow described this toward the end of his career. We're familiar with self-actualization, and that's where most of the textbooks stop, but actually he continued and spoke of self-transcendence, wherein one seeks to further a cause beyond the self and to experience a communion beyond the boundaries of the self through peak experience, such as mystical experiences. And the person who wrote this paper comments, at the level of self-actualization, the individual works to actualize the individual's own potential. There is thus, at least potentially, a certain self-aggrandizing aspect to this motivational stage, as there is with all the stages below it in Maslow's hierarchy. At the level of self-transcendence, the individual's own needs are put aside to a great extent in favor of service to others and to some higher force or cause conceived as being outside the personal self. Certainly, the image of the best developed human being that emerges from Maslow's hierarchy is very different, depending on which of these two stages is placed at the top of the motivational hierarchy. And by definition, this was actually what the Buddhist method was designed to facilitate, self-transcendence. It's described in other ways like nirvana, but it's self-transcendence. It goes along with it. So having briefly discussed then the clinical research, the biological research, and some of the philosophical background, I'll close by sharing a little bit, very briefly, about the Buddhist contemplative method. Now, there are 8 aspects of practice in this method, having to do with understanding and thought, speech, action, behavior, and mindfulness and concentration. And so these can be divided out into understanding thought, behavior, and focusing of the mind. Now, thus far, all of the studies that I presented you are focused on just 2 techniques out of the 8 that are available in the system. And in the system, it predicts that without all 3 of these aspects being brought to bear on the issue, that the effect will generally be transient. And so once one has a benefit, that benefit will tend to melt away over time. In fact, the reason why Siddhartha Gautama began a new way of approaching working with the mind, developing the mind, was because after going into very deep states of meditation, complete absorption, when he came out, he noticed that after a period of time, as that effect wore off, that the same old concerns in his mind and stress and suffering arose again. So this model seeks to work these 3 together in a coordinated way so as to produce persistent change. So I'll talk now about wisdom, which is not researched thus far in the West and is not taught that often in the West either. So I'll make the point that wisdom is knowing and seeing, and we realize that. So we have knowledge, things that become memory, and we say, well, I know that, I know how to do that. But seeing is something a bit different. For example, as you look at this beautiful photo of the tiger, you say, it's a picture of a tiger jay. So I've seen pictures of tigers before, right? And so, I know all about them. They probably weigh about 500 pounds, can get up to 8 to 10 feet in length, can be fierce. But imagine for a moment, if you will, that one was sitting right next to you, almost leaning up against you, was not in a cage, was not heavily tranquilized, was sitting right next to you. Really, for a minute, imagine claws this big, teeth this big, this kind of thing. And I'm told they don't like humans very much either. Okay? So imagine that. Well, before you knew about tigers, but now you see what a tiger is, right? It's a very different experience. And knowing and seeing in this contemplative method is essential for any progress. A second example of knowing and seeing. Did anyone in the room ever, during the course of your development, develop a kind of pattern of behavior that your parents didn't approve of, or someone else of greater wisdom, and they kept saying to you, you know, I foresee this becoming an issue. I foresee this, but you proceeded on anyway? Did anyone ever do that? One person, two, three. Well, exactly. Right. And so we've had that experience, and then one day something happens, right? And then suddenly we see it. You know, they were telling us, yeah, I know. And then this arises, and then we see it for ourselves, right? And now we go, well, we might say, man, I wish I'd listened, or whatever we do, but we rue, perhaps, that we didn't pay attention and heed. And so, although this is not exactly the same as what we use in this method in the experience, it still gets at the idea of the wisdom development. Every one of us in the room uses our innate wisdom. We use it to solve problems in the world, and we use it to work, and we use it to come up with new creative ideas, and so on. What we do with the Buddhist contemplative practice is learn how to use this wisdom to reflect it into the mind, to release suffering, to release dis-ease over the course of time, to continue learning how to do it. Mindfulness and concentration is necessary, and then we use some of the contemplation points as templates to penetrate into these patterns. Now, we've seen this cartoon over the years. Most people have, right? I've always enjoyed it for years, you know. And I'm afraid that just as I'm getting to this point about how one would reflect into the mind, we don't have time to get into it because it's a grand rounds in and of itself. But it's not the case that it's a miracle, okay? It's not the case that it somehow just occurs in the mind. It's a case of a stepwise analysis of the mind and what leads to dis-ease and what leads to suffering that we begin to contemplate in this method. So that would be for the second grand rounds in this area. But I will give you a taste of what we consider in contemplation as follows. Craving stimulates the flow of our consciousness according to this model. The untrained mind craves for sensual objects and pleasant experiences, and it does not readily acquiesce to limits. If it feels its car, house, job, or mate are unsatisfactory, then it thinks either to change or altogether replace them. If its sense of control is challenged, there arises the impulse to exert or even extend its authority. Now, we all know that these kinds of behaviors or ways of thinking at times can produce problems for us. During our waking hours, this craving enters awareness intermittently. At night, it penetrates our dreams in literal and symbolic forms. This craving is so ubiquitous, we have come to believe it's an inextricable aspect of the mind, or we perceive it as the mind itself. In Buddhist contemplation, one first strives to become familiar with this craving, both knowing and seeing it directly. This is accomplished by gently applying a braking process to craving so as to perceive it more clearly and to observe the mind's response to the intervention. Once the capacity to observe and tolerate craving is more fully developed, the practitioner devises new strategies based on the nature of their mind to release the pernicious craving. This generates greater flexibility, energy, and happiness in the mind. And so one can use thinking like this to analyze things and actually see a decrease in stress, see greater energy in the mind, and greater relaxation, just as one gets by sitting and closing their eyes and meditating. It's just a question of what seems most natural for the individual. So a couple final definitions about other types of meditation in this method. Alert meditation is a practice of reflecting on impermanence, not selfness, and suffering to gradually reduce craving in the mind. Non-duality meditation is an alert meditation in which a theme of contemplation, a feeling state, and an object of the mind are melded to generate an immediate and persistent reduction in craving. So, final comments. Varela's vision of contemplative science anticipates a collaboration between the fields of contemplation and neuroscience. Varela proposed that this endeavor would ultimately require contemplative neuroscientists, that is, neuroscience-trained individuals who had seen the effects of contemplation for themselves. Prior to the dawning of Western science for millennia, Buddhist contemplatives were the mind scientists of the East. Their accounts of utilizing techniques to develop higher levels of relaxed arousal, improved executive functioning, increases of positive affect, and the non-dual state of mindfulness wisdom are well documented through first-person narrative accounts and are embodied in the successors they trained. So I'll stop there. That's my email address if there are any questions or comments after today's session. Could you use the thank you. Yeah.
One of the big things I wonder about is, contemplative, very much inwards. What about comparing that with exercise? Because, that's been looked at as far as having a lot of health benefits and a variety of neurochemical and other changes happen. So that's one question that I was going to ask you about. The other thing is some of the studies you pointed out looked at primary care population. We've talked about the fact that this is really more relevant with the milder distress arenas, and I think rightly that for those that may have more severe symptoms on the GAF scale, that the medications are relevant. I think that makes sense with it. The other area that I would wonder about is sleep, the role of sleep in terms of daytime functioning, ability to concentrate, memory, consolidation, those kinds of things. And I was very intrigued with you saying that, if anything, with meditation, sleep decreases. Are there any EEG, I'm sure there are, examinations of what stages of sleep are they more in stage 4 or more in restorative sleep that allows them to function with 4 hours as opposed to what we traditionally look at 8 hours, et cetera?
Okay, so what was the first question? I think we've got a 1 in 4 part. Okay, exercise. So exercise has been used as an active control in some of these studies. And people did gain benefit from the exercise as well. So at least to my way of thinking, ultimately, what we're going forward, we will see primary care practitioners, for example, prescribing, 2 to 3 methods for people. Some people aren't going to exercise, we know that. Maybe later they would, but they may use mindfulness to gain benefit and get more control over the autonomic system. So each of them, and they are being compared in some of the studies. Question 2. Okay. I actually posed a very similar question last month at the Contemplative Science meeting to a sleep researcher who said, interesting question, we're beginning to look at it. Yeah, so we don't really fully know. But it is I can say, and I've tried not to talk from one side much more than the other. From the contemplative science side, the contemplative practice side, I should say, this is really widely known. I mean, it's just recognized amongst people. And the first time, 2 decades ago, when I went into the forest to study meditation overseas, I was amazed, because I was jet lagged, so I was awake all night, of course. And I was amazed to see these practitioners quietly moving around in the forest or doing walking meditation and hardly sleeping. And then next day they would get up, they would pile blocks up, they would work all day. Then the next night, and they weren't even grumpy. That's what shocked me. I mean, they flourished. So there is something to it, but it really remains to be investigated fully. And was there a final?
You talked about Alzheimer's.
Yes.
On the one hand, you're talking about some of the contemplative or the meditation methods, but then there's been in the past a lot of the, get them to do more activities, crossword puzzles, etc., as a way to diminish it, which is sort of a more heightened, perhaps more cognitively pushing scenario. So that is sort of an interesting perspective.
Well, one thing I didn't get into, but actually, if you look at mindfulness meditators who are advanced, their levels of activity in the dorsolateral prefrontal cortex and other areas actually is higher than beginning meditators. So they actually are activating their brain, but just in a different pattern, different neuronal networks.
I got some comments and maybe a question here. Anecdotally, Richard Alpert, who along with Timothy Leary became famous for giving LSD to a bunch of Harvard undergraduates in the late 50s or early 60s, subsequently became Ram Dass, went to India and spent a bunch of time in an ashram. And he wrote somewhere about giving his guru LSD. Nothing happened.
Huh.
And I wonder about that as perhaps an N of one example of resilience to psychotomimetic effects in somebody who has gained tremendous capacity in areas of the mind that many of us may not develop. The second thing has to do with the comment on exercise. And this is a personal experience. I think there's a great difference depending on how you exercise in terms of what it's going to do for your mind. Mm-hmm. If you're in a gym in front of a bank of TV screens with an iPod plugged into your ears, that's very different from other ways of exercising. And in particular, what I'm remembering when I was much younger and my bones were better, I ran at night in the dark on roads that had no traffic, sometimes very slowly, but sometimes for 2 or 3 hours at a time. And it did very unusual things in my head that were very similar to meditation. And then the third thing, I wanted to come back to that study you cited from Germany about teaching meditation to the psychotherapy trainees. That resonated for me very strongly with something that I have struggled with in terms of how to teach psychotherapy, because my observation is that when people are learning this, they focus a whole lot on the content of what the patient is saying. And what I struggle to get trainees away from is what they're talking about is nowhere near as important as how their mind is working when they are talking. And I want them to be more sensitive to the state of mind of the person as opposed to the content they're talking about. I don't know if that study had any process measures in it, but it would be fascinating to know, for example, if there was a sort of a contagion similar to emotional contagion. If you are in the presence of a meditator, does that alone have an effect on other people?
Begin to have some effect. They did look at measures of insight and awareness of the mind in the patients. And those were part of the outcomes that were separated out from those who did not meditate. And I can send you the paper, and you might look at it, see what you think. Do you? Okay. Yes, sir.
Jay, I think we're asking you multiple questions, maybe testing your mindfulness as a speaker, but I have two. One is from more the nomothetic. Thank you. One of my questions is more from the nomothetic perspective, and I was interested in immune effects of meditation, and there have been a number of studies that have suggested that there's increased T-cell proliferation to mitogens in response to meditation, which would, in some research I've done, suggest
relationship to the decrease in cortisol, and also improvements in NK activity, which might be more related to the sympathetic adrenomedullary decrements with meditation. So that was one thing in clinical relevance of that. But on the other side now, on the idiographic, I wanted to share with you of relevance to Tom's comment partly that I had been in India and traveled with Sri Sri Ravi Shankar and learned to some extent a yoga technique, Sudarshan Kriya Yoga, a breathing type of yoga. And I wondered if you would want to comment a little bit. I know this could be all grand rounds about yoga versus meditation in terms of differential effects, if any, and also the importance of different types of yoga, like you said, different types of meditation, which I was interested you mentioned.
Yes. So the first question having to do with the immune system is just as you say. It's been noted different types of meditation. A lot of it, to my memory, has been transcendental meditation, and a lot of it has demonstrated improvements of immune function. And there is a more recent study that showed that in the course of a day, that advanced meditators compared to controls could actually change the histone deacetylase activity in one of the immune system genes, could actually downregulate that which would normally drive up immune reactivity. So there clearly is a signal there. Again, getting back to the quality of the studies, they're improving all the time. And of course, it's always difficult to study any area. When we go back and we look at the early years of studying neurotransmitters, some of the papers are brilliant, and some of them just, they suffered from the limited techniques of the day in terms of fully examining them. So I'm curious to see, moving forward, as people devise more consistent types of meditation interventions, if this can be sorted out a bit more in terms of, because I've seen some studies that showed a positive effect, but some did not. So it will be interesting to see. And again, they're not subtyping people, and they have also not allowed them to take whatever technique they preferred either. Now, in terms of the different types of yoga and meditation and the different effects, my understanding of Sudarshan Kriya Yoga, and I attended an APA meeting several years ago where a practitioner and the psychiatrist presented data about its efficacy in depression. And it has been demonstrated effective in depression and anxiety, at least. And so this is a technique which is still being studied. It doesn't have quite the fad going right now that we see with mindfulness. The reason I really focused on mindfulness was not because of its popularity, but rather because of its closer link to this contemplative model I'm more familiar with. And so each of these types of techniques, first of all, people have to pick a technique which they can relate to, obviously. And so to my mind, because I've studied other techniques that I didn't get into today, and to my mind, then what we need is a full range of approaches which will share some common benefits, but will have other differences, and make them available to patients and to the general public. Because in going back to Maslow's hierarchy mentioned earlier, these techniques, we use them with patients, but then we also utilize them ourselves. And although we don't have a GAF of 150 that I know of, that is what these people over millennia have been seeking to do. They're seeking to move up in the higher ranges. So we start out with different types of techniques, but over time they sort of merge a little bit in terms of how people practice them and their experience of them.
Just to extend that ideographic comment about Sri Sri Ravi Shankar, I was very attuned to the experience of the practitioner and training and what impact that had on the outcomes in your own self-observation. And with him, he did a yoga practice for a prison yard. And the entire yard came down to an incredibly tranquil level during the meditative practice. And everyone I could see participated. It wasn't like a little subgroup. And afterward, there was a relative lull and then a return to activity, at least from the, outward observer level as normal. You wonder what internally was going on.
Okay. Dr. Griffith, thanks so much for speaking with us today. It was really interesting. I think we all are really looking forward to part 2. So thank you so much.
Thank you, sir.